maximum city registered over 15,000 cases in a single day, the highest so far. This comes amid swirling reports that there could be a lockdown in some parts of Mumbai and indeed Maharashtra. In a moment, I'll ask that question to the Mumbai Municipal Commissioner. But first, take a look at this report.
Maximum city is facing maximum surge. COVID cases continue to spiral with each passing day in Mumbai. From netas to Bollywood celebs to the common citizens, the surge is sparing no one. The surge has led to fears of the return of lockdown. The Maharashtra Vikas Aghadi government, which went into a huddle on Wednesday, has ruled out a complete shutdown.
हम लॉकडाउन यह परिभाषा अभी करने वाले भी नहीं है और लॉकडाउन का आज इमीडिएटली सोचने वाला बात भी नहीं है, लेकिन निश्चित तौर पर रेस्ट्रिक्शंस को और ज़्यादा अच्छी तरह से इम्प्लीमेंट करना, यानी जो निर्बंध लगाए गए उसको इम्प्लीमेंट करना, ये चैलेंजिंग काम है और ये होना जरूरी है.
The health minister's remark comes a day after Mumbai Mayor Kishori Pednekar hinted at a lockdown if cases crossed 20,000 a day.
ऐसे ही 20,000 के ऊपर रुग्ण पाए जा रहेंगे तो लॉकडाउन लगाना जरूरी होगा.
The COVID cases continue to spike despite curbs. Section 144 is already imposed till January 15th, with beaches and parks closed from 5 p.m. to 5 a.m. There is also a ban on large gatherings. Patient management remains the key to taming the Omicron wave. The Health Ministry has issued new home isolation guidelines. According to the norms, a patient should be categorized as mild or asymptomatic by a medical officer to be isolated at home. The patient's house should have the facility for self-isolation and quarantine of contact. Caregivers should be doubly vaccinated. There must be a communication link between the caregiver and medical officer so that the status of the patient can be monitored. Patients with comorbidities need the medical officer's nod for home isolation, else they need to be hospitalized. The third wave is yet to peak. The worry is if the cases grow exponentially, it may stress the hospitals even if most cases are mild. Bureau Report, India Today.
Mumbai is witnessing a record spike in COVID-19 cases, a higher surge than even during the second wave in the month of April. Joining me now is a very special guest. I'm joined by the Mumbai Municipal Commissioner, Iqbal Singh Chahal. Appreciate your joining us, Mr. Chahal. The question right at the very top that I want to ask you, more than 10,800 cases in a single day on Tuesday, crossing 11,000 now on Wednesday, the highest daily surge, even higher than April of 2021. Is Mumbai heading for a lockdown as people are fearing? Many Mumbaikars are asking this question. Is a lockdown now inevitable to stop this surge?
Hello, Rajdeep. Thank you very much for providing me this opportunity today to present our Mumbai COVID pandemic situation, the third wave. You know, whole of August, September, October, November till 20th of December, we had our positivity less than 1%. And with effect from 21st December, today the day 16, that the positivity is continuously on the ascendancy and it is unbroken going up. And the positivity has gone from 0.6% on 20th of December to now 22.4% last evening. And yesterday we got 10,800 cases. Today they can be even more than that. But let me give you very hard facts. In the last 15 days, today is day 16, we got 45,000 active cases additional. And out of this, only 3,400 have gone to hospital and almost none to ICU and not less than 150 to oxygenated beds. And in this pandemic, I would say that unlike Delta variant, which was very lethal and it would land you on oxygen or ICU, but immediately on detection in few hours, this is a very mild form. But at the same time, although there's no need to panic, but we have to be very cautious, very careful. We cannot lower guard, and we have to be careful. The numbers should not become humongous.
So, so to answer my question, are you saying no lockdown for now because the situation is under control? Number of oxygen beds are plentiful. It's not Omicron is not resulting in any pressure on the health infrastructure. Are you saying therefore no lockdown at least in the near future, Mr. Municipal Commissioner?
Yeah, in fact, on the 31st of December, Honorable CM Sir, Honorable Uddhav Thackeray Sir chaired a meeting to look at way forward, whether it's lockdown to be done or what restrictions are brought in. So I had made a very humble submission in that meeting, chaired by Honorable CM Sir, attended by all top officials of the state government and our other honorable ministers. I said that third wave is different from the first and second wave when positivity was the benchmark. The government of India would say that once the positivity goes beyond 5%, the situation for lockdown starts arising. Here, that day on 31st December, our positivity was 12%. Today is 22%. I said, instead of positivity being a benchmark, the new benchmark should be hospitalization. How many hospital beds are vacant? ICU, oxygen, other beds. And second, what is the status of our health infrastructure in general? Now, everybody agreed that since Mumbai has even today almost 94%, 96% beds lying vacant in hospitals, hardly anybody in ICU, and people going to even oxygenated beds are also, people are going more as a matter of precaution. People who are very aged, they are highly comorbid. Otherwise, 90 to 91% people out of this 10,000, 11,000 coming now are asymptomatic. They don't need any medication. They just need to isolate themselves home. And remaining 9%, 10% also, half of them, they don't go to hospitals. So it was decided that we will again meet around 10th of January and see how things are unfolding. Until that time, we didn't bring any more restrictions except two. Number one, we said that from 5 p.m. to 5 a.m., we would avoid gatherings as the crowded places like Gateway of India, Marine Drive, and beaches of Mumbai, nothing more than that. And secondly, we said that from 3rd of Jan, we will close the schools for 3 weeks as a matter of abundant precaution from class 1 to class 8. But class 9 to class 12, the children shall come to school for vaccination purposes. We have launched the vaccination drive on 3rd.
You know, but Mr. Chahal, you spoke about hospitalizations and saying that they remain reassuringly low. But the worry is that if these numbers scale up, then hospitalizations will increase. Let me pose a number to you. Hospital bed occupancy on December 31st in Mumbai, Mr. Chahal, was 8%. It's gone up on 4th January to 15%, 30,565 beds, out of which 4,491 are occupied. Is there a worry that just the sheer scale, if now what is 10, 11,000 per day becomes 20,000, then automatically bed occupancy would increase? Is there a figure you're looking at which stage you get worried? You seem to be sounding very confident and having the situation under control today. Is there a number, as you said, hospitalizations are the key? What is that key figure that you're looking at which point you start getting worried?
I'd like to mention 3 points here. Number one, we are expecting this figure to go beyond 20,000 in next 3 or 4 or 5 days. And the experts are telling us, the IIT has just told us in the morning that Mumbai is going to peak between 6th and 15th of Jan. And after that, the cases would start falling down. This is number one. Number two, our state task force has told me that now 90% plus is Omicron, 10% is Delta. And in next 3 to 4 days, Omicron will become 100% in Mumbai. It will completely replace Delta variant. That's good news because as the percentage is going up of Omicron, the hospitalization is coming down in percentage terms. And once you have 10% Omicron, the hospitalization further reduce. Now, next point is that unlike Delta variant, which took you to hospital for 7 days, 10 days, 14 days on normal bed, and maybe 3 weeks, 4 weeks on ICU ventilator beds, the turnaround time in Omicron is just 3 to 5 days. On day 5, most of the patient getting admitted are getting negative and they are being discharged. The cycle is very fast here. And we have 30,000 beds and we have only 4,500 beds occupied today. So even with a figure of 20,000 coming a day, I think it will be a comfortable situation. But I always say we have to be very careful because the figure should not become humongous beyond control. So if the figures start going beyond a certain extent, maybe it starts going beyond 20,000, 22,000 a day, then certain more restrictions will come in place. But as a lockdown is concerned, Honorable CM Sir has made it very clear that government is not interested in lockdown. People have to decide. If the people behave, they show COVID-appropriate behavior, they can keep the option of COVID, this lockdown away.
You know, you've said something very important. You are saying that what you're hearing from the modeling makers, including at IIT, that the wave will peak between January 6th and 15th. So that's not too long from now. So Mumbai will peak possibly beyond 20,000 cases a day in this period and then go down equally rapidly. Importantly, you're saying a time will come shortly where 100% of the cases in Mumbai will be Omicron and not Delta, which again is very, very significant given that Omicron is showing mild symptoms. The question then is there a need to seal buildings? You all are going around sealing buildings. You've got night curfews in place. Presumably, you're telling me these are only precautionary measures. There is no need to panic. Because, you know, when we look at these caseload numbers, people start panicking, 10,000, 20,000. You're telling me there is, from a BMC perspective, official perspective, there is no need to panic. Omicron is under control and importantly is not leading to hospitalizations or ICU beds being needed.
You sir, I think today, day 16, when this wave started, and we got 45,000 cases in the last 15 days. And you know, there are only 14 deaths out of 45,000. Our average death per day is less than 1. We had 14 deaths in 15 days. Otherwise, like people who got positive 15 days back, something would happen to them today after 2 weeks. So death rate is well under control. Hospitalization beds, even despite the fact that 10,000 cases coming, we have 94% beds lying vacant. The buildings, sealed buildings also, we are acting as a precaution that people should not roam around. They should isolate themselves. The virus should not spread beyond a point. It should control the spread of virus. That's why people should remain indoors. That is the purpose of sealing the building. These are all precautionary measures, but absolutely no cause of panic, I always say.
No, because you see, there are mixed signals. Just a few days ago, the Shiv Sena organized these cultural festivals in Bandra, Andheri, large crowds gathered. There is a sense that, you know, we need clarity. Do we need to have these large gatherings at all in the first place? Or are there different rules for different people? That the Aam Aadmi is told, you stay at home, don't work from home, but, you know, you will allow these gatherings. Are we very clear that at least for this month of January, there will be, you know, there are clear rules for all, whether you're a Khas Aadmi or an Aam Aadmi?
You know, Rajdeep, we have to be very careful and these gatherings should be avoided. In fact, that Bandra thing, the moment I realized, I immediately sent in a message and that thing went online and just stopped gathering immediately within half an hour of my message going there. People listen and they're disciplined. And I would say that people in Mumbai really listen and they're very disciplined and they have been exhibiting good COVID-appropriate behavior, both in wave 1 and 2. But now also, with the resistance, I am sure we'll tide over this in next 2 weeks' time.
One of the challenges, of course, and this is in April was vaccinations. Today, Mumbai is in a much better place with vaccinations. But is there a point where you can say confidently Mumbai will achieve a 100% vaccination target? Because the more you're vaccinated, the less chance of going to hospital. 15 to 18 vaccinations have started. Is there a point where you can say confidently Mumbai will be 100% vaccinated?
Rajdeep, you know, the main difference which Mumbai has advantage is that our vaccination is one of the best anywhere. We have done 108% first dose with floating population covered, and even second dose is now nearing 90%. We have 2.1 million vaccines available with us, 14 lakh in private hospitals and 7 lakh with BMC. There's no shortage. And this last 10%, last mile, this is remaining because people are due. Because in Covishield, there's 84 days gap. People who are not due, we can't vaccinate them. If we had the period would have been reduced, we could have achieved 100% by now, second dose also. Now, this is number one. And this is another reason why Omicron is not harming Mumbai. But it may not be the same scenario in rest of the state and rest of the country, where that's why our state health department is worried for rest of Maharashtra state. In rural areas or smaller towns where vaccination is low, this Omicron can again create a lot of problems like way is doing in USA. Like in USA, the death rate is 10 times of UK. Because UK, you have boosters and vaccination done. USA, vaccination is poor. A lot of unvaccinated people are there. Same could be scenario between Mumbai and rest of the state. That's why our honorable leaders, our health secretary is very worried that things might be different there. But Mumbai, because of vaccination, we are very lucky. And now for children's vaccination also, we have 4.54 lakh children between the age group of 15 to 18 in Mumbai. We started their vaccination on Monday. And by a day after tomorrow, we will finish all vaccination of 37,000 children from BMC schools. And then we are taking one school at a time. We close the schools, but we have kept class 9 to class 12 open because that will help us in vaccination. And we are going whole hog there also.
Sir, I want to ask you in conclusion, it's been a tough 18 months for everyone within the BMC. How are you keeping morale up? Is COVID fatigue set in? Or do you believe that people continue to persist with COVID appropriate behavior and your BMC staff is as enthused today as they were 18, 20 months ago in taking on COVID?
We had got a lot of break between June and December, and I can assure you there is absolutely no fatigue at all. Today morning also, the report came to me that yesterday we find 10,000 people in Mumbai not wearing masks in public domain. We find 43 lakh people in Mumbai, 4.3 million for not wearing masks, collected 86 crore rupees. This shows that there is no fatigue when we are finding 10,000 people every day. The team is in top spirit. There's nothing to worry on that front.
Mr. Chahal, please find the politicians in Maharashtra who are attending these big weddings. And many of them are without masks. There are photographs of them attending big weddings without masks. Please find them also.
Yeah, Rajdeep, I forgot to mention that we have brought down weddings from 1,000 to 50 and funerals from 250 to 25 now. I can assure you that we have our squads are roaming around, that if there is any wedding more than 50, we are going to find them.
No, if a minister is found without a mask, please find the minister also. Don't only find the Aam Janta. That's my only last plea to you, sir.
Rajdeep, everybody is equal in the eyes of law, and I assure you that there will be no exemption.
Okay. I think that's a very positive note, Mr. Chahal. I know you've been tireless in this fight against COVID, and it's not been easy in a city like Mumbai, a congested city, to take on COVID. But you've sent out a very clear, reassuring message today on the show, and hopefully there will be need for no more restrictions in Mumbai, and we will get over the Omicron wave sooner rather than later. Thank you very much, Iqbal Singh Chahal, for joining me here on the news today. Thank you.
Thank you, sir.